Good evening, all respected seniors, senior faculty, the doyens of the medical fraternity, having a vast experience of yoga and all other specialties. I welcome you all, and I welcome you all the delegates on behalf of American College of Physicians India Chapter as the Vice President. Today, in the next 1.5 hours, we will be talking about and we will be learning many things from our stalwarts regarding the holistic health management and well-being for healthcare professionals, yoga connecting body, mind, and soul. And this is on the International Yoga Day, and you all know that with the efforts of our Honorable Prime Minister Sri Narendra Modi, this was started in the year 2014, and it was the mastermind of Sri Narendra Modi ji, which was accepted by 170 countries, and then it was finally decided and it was declared by the international body as the World Yoga Day, the 21st of June every year. And the theme of this year is Yoga for Humanity, which is very, very important. And in the next 1 hour, we will have the panel discussion where our esteemed panelist, Professor Kamlakar Tripathi. I think everybody knows Professor Kamlakar Tripathi, who has recently been honored with the National Award, the Padma Shri Award, one of the highest national awards. He is the former professor and head Department of Medicine, Institute of Medical Sciences, BHU Varanasi, joined by another stalwart, Padma Shri Dr. Subhash Manchanda, who has been the Director of All India Institute of Medical Sciences and a senior cardiologist and still very actively working as Dr. Kamlakar Tripathi sir. So at present he is attached to Sir Gangaram Hospital as the senior consultant cardiologist, and he has a lot of studies and lot of work in the real yoga and medical education, not only education in the cardiology regarding the yoga. And I will request Dr. Vasant Kumar, he is our another panelist. He'll be joining, he has already joined here, but he will be one of the panelists. He is senior consultant, physician, gerontologist, and diabetologist, and at the present time, he is the president, national president of Research Society for the Study of Diabetes in India. And you all know that RSSDI at the present time is doing very wonderful work. So welcome you, sir. And my good friend, Professor Sandeep Rai, who is a senior consultant diabetologist physician from the Mahatma Gandhi Medical College University at the Navi Mumbai. And he's also attached to Apollo Hospital. So these are our 4 worthy panelists, and we will listen to them and we will learn many things from them. And to chair these important sessions, we have Dr. Srinivas Murthy, Dr. Anubhav Srivastav. Dr. Srinivas Murthy is the real researcher. Dr. Srinivas, I can't see you. Where are you? Okay, now I can see you.
Sir, I am here, sir.
So he is senior consultant physician and diabetologist at Life Care Hospital and Research Center in Bengaluru, and he is one of the very few researchers who are at the top at the present time in his research, and he has a very good knowledge and vast and interest in the yoga. Then Dr. Anubhav Srivastav, I think I can say she's youngest professor of MMFC, endocrinology, professor of medicine at the Motilal Nehru Medical College, Prayagraj, UP. The first hour will be the panel discussion on yoga, and the first thing which I told you earlier, the yoga connecting body, mind, and soul, the clinical evidences, and then after that there will be one half an hour talk by Dr. Shashikant K. Kumbar, who is the yoga and rehabilitation doctor of medicine, MD in yoga and rehabilitation and MSc in the applied psychology, and founder and director of I Am Well Integrative Medicine and Wellness. And he will tell us about what is the science behind yoga. So then I will not take much time, but I will welcome you all on behalf of ACP India Chapter. And now I would I'll ask the technical people to please run the video from our video message from our Governor ACP India Chapter, Professor Anuj Maheshwari. Technical team, please.
Hi friends, myself Dr. Anuj Maheshwari, Governor, American College of Physicians. Today is World Yoga Day and I wish to pass on my greetings to all members as well as those who are seeing this program on this auspicious World Yoga Day. As we all know, yoga is an ancient tradition which has been invented in India by an Indian saint, Maharishi Patanjali. Yoga is, by its name, it is a word which means addition, as well as we can also use it for the union. So whenever we try to add our body with our soul, and we try to mind with our soul, and all these three unite together, then the yoga accomplished its goal. Yoga is a method through which we add life to our body, through which we add soul to our body, and mindful ideas can be added to our life, and we also can add years to our age. We can also add health to our life. At the same time, we can also use this specifically yoga method for addition of calmness, happiness in the life which is full of internal conflicts if it is. So yoga is a thing which can pave the way for a healthy, happy and disease-free life. This is a method through which we can achieve the freedom from illness, freedom from sorrows, and develop our life in a better, healthy way. Today's program has been well designed by our ACP team of the India chapter. Especially I would mention Dr. Padma Gulati, Dr. Srinivas Murthy and Dr. Anubha Srivastava, who have designed this program today under the guidance of our Vice President Dr. J.K. Sharma and Secretary Dr. Narsingh Verma and ECP Wing in charge Dr. Amit Gupta. They have invited very good panelists, out of which one is Dr. Kamlakar Tripathi, who is not only a great panelist and great preacher of the yoga, but also our advisory council member and recently awarded Padma Shri for his academic acumen. Apart from that, we have many other personalities as a speaker, as a panelist for today's program, which will be capable answering your all queries related to yoga. I believe today's program will also be benefited for you in adding up the knowledge to your existing information about yoga. Thank you.
So, with thanks to Dr. Anuj, our governor, now I take you to the next one, which we are going to start. We will start with the panel discussion, philosophy of yoga and clinical benefits. And then will come the science behind yoga. And to chair this important session is Professor Narsingh Verma, who is Professor and Head Department of Physiology, KGMU, Lucknow, accompanied by Dr. R.R. Singh, who is a consultant physician, diabetologist and cardiologist at Raghavendra Hospital and Heart Center from Jhansi, and Dr. Amit Gupta, who is Director of Center for Diabetes Care in Greater Noida. But the very most important person to whom I will introduce to you is Dr. Padma Shri Gulati. She is the mastermind behind today's program. She is fellow of ACP UPDA, fellow of the UPDA, consultant physician and diabetologist, and at Gulati Hospital, honorary visiting specialist at District Railway Hospital, Jhansi. So, Madam will moderate this whole program. So now I hand over the proceedings to Dr. Padma Sri Gulati.
Thank you, Dr. Sharma, and thank you. Good evening, all, and thank you, everyone, for being here. So, without further ado, we would start with the program. And as we all know, that yoga is derived from a Sanskrit word yoj, that means union of body, mind, and soul to attain a state of eternal bliss. Samatvam yog uchyate, that is, transcendence of mind to realize the true self is the ultimate aim of yoga. अपनी आत्मा के साथ एकाकार होने के अनुभव को ही योग कहते हैं. Very few of us would be knowing that Lord Shiva, the Adi Yogi, was known as the father of ancient yoga. And then sage Patanjali codified all aspects of yoga into a certain format, which are now known as Yoga Sutra. So there are different forms of yoga. We have Ashtanga Yoga, which is mentioned in Patanjali's Yoga Sutra. And this provides with basic guidelines and on how to live a meaningful and purposeful life. Then we have Hatha Yoga. In this, asanas, they occupy an important place and keep the spine, muscles, nerves, and endocrine glands in healthy condition and give strength and vigor to the whole body. It is practiced at a slower pace with focus on the breath, control movements, and stretching. Then we have Vinyasa Yoga. This is a form of yoga where transition from one pose to another takes place very quickly. It incorporates variety of postures that engage and strengthen the core muscles. It increases blood flow and works with the cardiovascular system to create heat, thus making it more intense. And Power Yoga is a form of Vinyasa Yoga. Then we have heard about Iyengar Yoga, which is a form of yoga where yoga is done as an exercise with a focus on the structural alignment of the physical body through the practice of asanas. It is done with precision in a proper sequence using props. Sahaj Yoga is where Kundalini is awakened by self-realization. Then we have Hot Yoga, which is performed at 40 degrees centigrade with 40 to 60% of humidity. And the purpose is to increase heart rate for a more intense workout and for the heart to loosen the muscles. Restorative yoga, which is the practice of asanas which are held for longer than conventional yoga to relax body, to reduce stress, both mental and emotional, and this prepares one to do pranayama. And the latest is modern yoga, where yoga is done as an exercise consisting mainly of postures, often connected by flowing sequences, sometimes accompanied by breath exercises, and frequently ending with shavasana. It is this form of yoga or the Iyengar Yoga that has become familiar across the world. So with this brief introduction, I would now start with my first question to Professor Kamlapati Tripathi, sir. So what is Ashtanga Yoga? What are the 8 limbs of yoga for the harmonious development of body, mind, and soul? Dr. Tripathi, sir.
Thank you, Dr. Gulati. This is the first commandment when the Patanjali wrote it. The second word, Yoga Chitta Vritti Nirodha, means when you unite with the God, with the Almighty, with whatever purpose you have, every deed you do, Yoga Satsu Karmari, when you do the karma, the deed, the final part of your life, or the beginning, or the middle, or the education, or the surgery, or the routine, at the end of it, you have to unite to the God. Now to command it, to concentrate it, to put into the action, the thought, the process, the action, and the skill together. Your mind, the heart, and the action is to be united together with the Almighty. That's what all it means. Chitta Vritti Nirodha. Therefore, we have 8 components you said in the beginning. And one of the component which starts from the beginning is the component which is called Yam, Niyam, Asam, Pranayam. And this is the Yam means the ambitious, the desire which you start with. And Yam itself has a 5 component. And this is from where I want to give you the guide that these 5 components are to begin with important part. In Ashtanga Yoga, you have the asanas. Today, what we practicing are the asanas, because when you unite or anybody unites and does the good deed, he needs to remain healthy. A doctor cannot become a good doctor until unless he himself is healthy, a warrior, a businessman. And to have that healthy lifestyle, he needs 5 important components to take and these are the do's and don'ts. Ahimsa, we all know non-violence. Satya, truthfulness. We know the Astaya, Brahmacharya, and Apigraha. All these 5 components are very difficult to adhere on the modern day text. We have many diseases because of that. Whether it is the central nervous system, whether it is a connection between the pituitary, the hypothalamus, the adrenal, the cortex, and then its connection. So they all control the autonomic nervous system, the secretion of the endocrine and the catecholamine and the cortisol, increasing the immune process. So all these exercises in relation to specific the metabolic syndrome, in relation to the blood pressure, in relation to the psychiatric disorder, they are related with these 5 components. But the background is that until unless we purify, and that is what, who is Patanjali? He is the same person who wrote the Ayurveda Charak. Yogena chittasya padena vacham yatha shariram balam shariram cha vaidyakena yam pam karote muninam pravarar muninam Patanjalim pranjali mat karosmi. Meaning by the way the yoga, you purify your heart. With the words and the grammar, you purify your Sanskrit. Padena vacham means the prose, the composition, the way the doctor purifies the body and makes its capacitance. That's what the Vaidya does. The same way Patanjali wrote and prescribed the yoga and the medicine together in the development history of the Ayurveda. And therefore, in Ayurveda, right from the beginning, it's an important component to purify the body so that you can prescribe a medicine according to your tridosh, and then you give that particular molecule to the individual. So to have all this, we need these 5 components to begin with. Then probably we would be able to answer the yoga in right perspective. Next question.
Okay. थैंक यू डॉक्टर त्रिपाठी, आपने बहुत ठीक बताया कि अनुशासन द्वारा चित्त का शुद्धिकरण बहुत जरूरी है। इससे पहले कि हम आसन शुरू करें जो कि स्थिरम सुखम आसनम, दैट इज शारीरिक संस्थिति की स्थिति होती है, एंड देन वी बिगिन विद अ इनवर्ड जर्नी दैट इन्वॉल्व्स प्राणायाम, दैट इज ब्रेथ कंट्रोल, प्रत्याहार, दैट इज विड्रॉल ऑफ सेंसेस फ्रॉम द आउटर वर्ल्ड, concentration, meditation, and absorption. So this is how we attain balance between body, mind, and soul. So as we all know, there are 7 chakras in a body, which are Mooladhara, Swadhisthana, Manipura, Anahat, Vishuddhi, Agya Chakra, Sahasrara, and Ujjayi Chakra. And there are many nadis, and mainly there are 3 nadis which are most significant, that is Sushumna nadis, Ida, and Pingla nadis. Ida and Pingla nadis have opposite forces, and the energy flows in both the nadis every 1.5 hours. And when the flow is equal on both the nadis, then the main energy is channelized through Sushumna nadi, which is prerequisite for meditation. So my next question is to Dr. Sandeep Rai, sir. What is Sahaj Yoga? Is it synonymous with meditation?
Yeah, thank you, madam. Madam, Sahaj Yoga is, it has its roots basically in the Vedic, ancient Vedic science. As you mentioned, madam, the earliest inscriptions of yoga were Sri Shiva sitting in the prototype pose, and he is the earliest yogi, with Patanjali then later on giving us all the 8 limbs of yoga. Sahaj Yoga deals with it deals with your activation of your innate subtle energy which is located hypothetically, according to our Vedic science and literature and even Patanjali Yoga, in the sacrum bone. Now, sacrum bone, the word comes sacrum from Greek. They also knew that this bone is sacred because sacrum means a sacred bone. And here is that energy which is called the Kundalini energy. And if once activated, it passes through all these 6 plexuses which you had mentioned, including the Swadhisthana, Nabhi, the heart plexus. And when it crosses the forehead plexus, that is the Agya Chakra, your thoughts start settling down. They start coming down. And finally, it pierces through the Brahmarandra, which is the anterior fontanelle area. And from here, when it unites with the cosmic energy, yoga is said to have taken place. The union, the huge word, meaning your internal energy getting united with the cosmic energy. That is the happening that is called as yoga. Now, various methods have been described to achieve this. Sahaj Yoga meditation is one of these methods. It basically silences your mind. The hypothesis is that this innate energy activates and actualizes the limbic system of the brain. Limbic system controls through the hypothalamus, the autonomic system. And so your sympathetic system comes down, your parasympathetic system is little upgraded. So you attain a balance and a stress-free life. And also through the hypothalamus is your HPA axis. So your hormones, cortisol and epinephrine, all these hormones are decreased, and it gives you a stress-free state, a state of mental silence and of less mental clutter. And we have, as doctors, we have seen and researched this for last 25 years. I'm practicing it, experiencing it, and researching it also. Earlier, my father, Professor U.C. Rai, was a principal of Lady Hardinge Medical College, and Jipmer also, HOD in physiology, did researches in Lady Hardinge Medical College on Sahaj Yoga. They were MD physiology theses, and they showed that heart rate, blood pressure, your adrenaline byproducts, VMA, and all decreased. And they showed that it decreases the sympathetic system, upgrades the parasympathetic. And then we continued the researches and showed at our MGM Institute of Health Sciences, along with International Sahaj Yoga Research Center in Mumbai, that your heart rate variability increases, your stress decreases, your anxiety decreases. So it has a lot of factors. So indirectly, that Kundalini and its activation, we can't see that Kundalini and that energy, but what we are studying and seeing are the indirect effects in terms of decrease of stress, anxiety, heart rate, blood pressure, and many things.
Dr. Gulati.
Yeah, thank you, Dr. Sandeep. So rightly said, by doing regular Sahaj Yoga and meditation, we can harness the inner powerful energy and improve our health. As we all know, that health is defined as a state of physical, mental, emotional, and spiritual well-being, and not merely an absence of disease or infirmity. And now yoga has regularly been advocated by doctors all across the globe in the form of therapy based on clinical evidences. So my next question is to Dr. H.C. Manchanda, sir. Is yoga preventive, therapeutic, or both for cardiac patients? Dr. Manchanda, sir.
Well, good evening, everybody, and greetings to everybody on the World Yoga Day. Well, as you heard, yoga has several medical advantages. That's why it's becoming popular all over the world, because of its health benefit. Now it has all the three aspects of uses in medicine. For example, it is a health promotive exercise. Actually, we have not been talking too much of health promotion, but I think if it is done from the early childhood, then the so-called risk factors do not develop. So health promotion is absolutely a very important part of it. And this whole science of well-being is being developed because of that. Then secondly, it has a tremendous preventive value. We have done a lot of studies to show that it can prevent not only heart disease, but all the lifestyle related diseases. A lot of data is there that all the risk factors for heart disease, as you know, heart disease is a continuum, starting with risk factors, then there's inflammation, then there's atherosclerosis, myocardial infarction, arrhythmias, and heart failure. It has been shown that yoga acts at all the levels. The most important is prevention of heart disease if you tackle the risk factors, all the risk factors, like hypertension. For example, there are more than 1,000 studies in hypertension. It has been consistently shown that yoga can decrease blood pressure, although to a modest degree. The recent study in 2022 recently shows that it can be as much as 11 millimeters systolic and 6 millimeters. That's equal to any antihypertensive drug. And there are no side effects with that. It is extremely useful for prevention of diabetes. Also, a huge study done from Bangalore has shown that multicentral study in 3,000 patients, pre-diabetes, the onset of diabetes can be stopped in more than half the patients by yoga study. Then it has been shown to control the stress and depression, which is a very important risk factor for heart disease. Also, it has been shown that it could be useful in obesity. It has been shown to be useful in even tobacco cessation. So all the risk factors that we know of can be significantly reduced. Then the inflammation, which is a very important part, has also been shown in several studies. Atherosclerosis, we have done studies, early atherosclerosis can be reversed. It can also, advanced atherosclerosis, it can halt to a great extent. We have done a study recently that in heart failure, it can be used as a adjunct therapy, and it decreases not only the symptoms, improves the quality of life, but also decreases the biomarkers like NT-proBNP and so on, and even an arrhythmia. So the whole continuum of this can be controlled. And there's a huge study. I think we need large studies, and larger studies done was on cardiac rehabilitation in 26 centers after myocardial infarction and stent implantation. If we use yoga in 2 years, there's a decrease in this repeat myocardial infarction, stroke, and heart attacks and all. So I think it has both preventive values, both primary and secondary. Enough data is there, not only, as I said, heart disease, but other diseases also like diabetes. Then it has a therapeutic value. We have used this in the management of several patients of hypertension, early hypertension, early diabetes, early obesity, and even many patients of anxiety, depression, even joint pains, etc. It has a lot of therapeutic value. And there are a huge number of studies, especially low backache and other features are there. As I showed you in secondary prevention of coronary artery disease, it has a tremendous role, and we are using it in almost every patient who undergoes angioplasty or undergoes bypass surgery, because large number of studies are available now, huge number of studies which show that if you add this, not only stress and depression are controlled, but also the hard endpoints like the repeat myocardial infarction, stroke, etc. decrease. So I would say that yoga has both promotive, preventive, and therapeutic value in heart disease. Not only heart disease, but heart disease is caused by hypertension and diabetes and obesity. All these factors are also controlled by yoga. Unfortunately, what has happened is the studies are limited in number, and there's a lack of large-scale multi-central trial utilizing the same methodology. Some studies are started already. As I said, we have done that largest study ever on cardiac rehabilitation, 26 centers and 4,000 using us. And similar studies are needed. We are doing a study now on heart failure again in 30 centers, and also in hypertension and diabetes. Of course, some studies have been done. I think studies are needed so that it can be accepted. But already the many medical associations have accepted yoga as a part of the modern therapy. For example, the latest guidelines, International Society of Hypertension, have suggested that yoga and meditation should be included as non-pharmacological measures, because they can control stress and they can also be a part of exercise. So I think it is already coming into the practice, and top journals like Journal of American College of Cardiology, etc., are accepting the articles which were never accepted earlier. There's a very recent article that this neurocardiogenic syncope, we had no treatment for vasovagal syncope, can also be controlled by this. So yoga has tremendous value, I would say. That's why it has become very popular in cardiology, and many centers in the world now, cardiology centers, have yoga in addition, either primarily or as addition for primary and secondary prevention of heart disease.
Thank you, Dr. Manchanda sir, for your valuable inputs on the preventive and therapeutic aspect of yoga, especially in cardiology. And rightly said, it takes care of the various risk factors like stress, depression, obesity, tobacco, and inflammation, and atherosclerosis. And it's very important in earlier course of the disease. And I believe when you do yoga, especially when one does meditation or deep breathing pranayam, then heart rate and respiratory rate, that is a sympathetic drive that goes down. That also reduces heart rate. And as we know, whenever there's an increase in heart rate, the diastole is cut short. That happens at the cost of diastole. And the filling of coronary vessels happens mainly in the diastole. So when we are doing regular yoga and meditation, coronary blood flow is also well taken care of. Thank you, sir. So my next question is to Dr. Vasant Kumar, who's President National RSS DI and is a senior diabetologist in Apollo Hospital. So what are the beneficial effects of yoga practices on type 2 diabetic patients? Is it useful in type 1 diabetics and gestational diabetes as well? Over to Dr. Vasant, sir.
Thank you, Dr. Padma. It was a very learning experience for me to listen to all the learned panelists who have dealt with various aspects of yoga, the ancient science, as we know, which I'm not going to repeat. And we definitely know the huge benefits of yoga in preventing as well as managing most of the chronic diseases. It is now accepted worldwide. Only thing is we need to popularize it. We need to sometimes see that it reaches our patients so that they are benefited. As all of you have already mentioned, yoga has, as you know, at least 3 components when it comes to practically doing. Whether it's yogasana or hatha yoga, what we call, then the pranayam, which we talk, where the breathing exercises, and the third one, and also very important one, is meditation. So yoga is achieving the physical as well as mental well-being. It's not only controlling the disease, as Dr. Manchanda said, we are looking at and also Dr. Tripathi ji said, that we are looking at preventing diseases and even promoting good health amongst our people. So diabetes is no exception, being a metabolic disease, being a lifestyle disease, especially for type 2 diabetics. Yoga definitely helps in so many ways, because these 3 components, what is finally important is we have to make sure that the people follow all the 3 components, the yoga asana, the physical part of it, because it's so important that it is always done with the rhythmic breathing. So it has so many advantages on the autonomic system, sympathetic and parasympathetic system, and especially on the brain, where today we are talking stress causes so many conditions. So the stress can be relieved with the meditation. So what is important is it also has to be individualized sometimes to our patients. And the most important thing is the person who teaches it, whom we call guru traditionally, has to one have to learn it from a guru to start with, and one has to follow it on a long-term basis to derive the maximum benefits. As Dr. Padma mentioned, we know what is health. Health is not merely absence of disease, it's a state of mental, physical, and social well-being. And also we add the spiritual to it. So nothing like yoga that can promote health. And coming about type 1 diabetic children, we also have a lot of young diabetics and type 1 who have already passed childhood, and there are also small children. So we need to be attentive and careful in choosing the person whom we promote yoga for their benefit. Certainly yoga has its benefit, and recently some studies are coming out which are showing some of the benefits in the acute phase as well as in the long-term basis about how it improves. Because most of the children, if you know, they are in the growing phase. So it really improves their muscle strength. It improves them to handle their chronic disease where they require insulin. Their mental capacity improves. Their ability to cope up with the disease definitely improves. So in a holistic approach, nothing can beat yoga. But the important point now is we are talking about it, but how do we popularize it? How do we make it simpler, safer for each individual? How do we individualize it? Because finally, actually, sometimes it looks, very immature for us to think for this ancient science. Now we are trying to combine it with the modern science and try to see how we what is called evidence-based medicine. We can't really do it together. We have to accept it. And of course, some studies definitely prove that this is going to be of great benefit. So I think this is a great opportunity that we all have now And following this, let us see how we further popularize, further make it tailor-made, and see all these three important components of yoga will be useful to our patients to prevent disease and promote health. That's the important thing, Dr. Padma. I think I'll stop it here because we have other panelists to speak. Thank you.
Thank you, Doctor. Thank you, Dr. Vasant Kumar. And rightly said, yoga, when it's done in its proper form, it regulates a lifestyle and leads us to lead a disciplined life, and it takes care of stress. And majority of the diseases are lifestyle disorders. So they are well taken care of by yoga, and it's been incorporated based on the clinical evidences that we have now. And we'll be talking about it in the later half of the session. And yoga has been incorporated as a therapeutic therapy, And at times one really gets confused whether to say yoga or yoga, because when you speak in Hindi or Sanskrit, it's called yoga. And now when we are speaking in English, we say yoga. So my next question is to Dr. Tripathi sir again. Dr. Tripathi, we would like to know from you, what is Hatha Yoga and Raj Yoga? And which style of yoga do we refer to when we talk about holistic approach to health and well-being? Dr. Tripathi sir.
Hatha Yoga is the yoga, some of the yoga which is directly related to prevention, as Dr. Manchanda was talking about. This is done by the yogis, true yogis, who go to the Himalaya and remain disease-free, virtually free, live in the -40 temperature without clothes. So they set their physiological need and the temperature and the thermoregulator center at a very different level. In Hatha Yoga, you can reverse your abdominal movement, you can clean your abdomen, you can breathe, you can control your heart rate, you can control your respiration, you can bring your BMI to a very, very low required level. You may live for many, many days without food. Hatha Yoga is not for the common person to use it. Sick people cannot have it. It's only for a limited period of time, like in Buddhist culture. There are some disturbances. Can you tell to the organizer to set the speaker? Somebody's talking in between. So otherwise, the Hatha Yoga is with the Buddhist monk who take the monkship for a short period and then come to the real life. It is with the Japanese also, it is with the Cambodian, all these Buddhist tradition, the Hatha Yoga, and it has achieved a great height in the time of the Takshashila and the time of we have the Buddhist in India, during India rule of the Ashoka great. At that time, we have like physicians, older physicians who did the surgery on totally without using any anesthesia, and all these surgeons, Jivak is one of the very well-known surgeon who did it, and the contemporary physicians of that time, the Jivak time during the Buddhism period, 280, they all did it. So Hatha Yoga is primarily from that. The Raj Yoga is that. Did you talk about the Raj Yoga?
Yes.
Second yoga?
Yes.
Raj Yoga is the one which is in the active life, when you take it for the person who is living with grandeur, who is living with the worldly affair and still is not sick, is in a preventive state, and with all possible diseases affecting to him because he is under stress. He could have a hypertension, he could have a GI manifestation, he could have a diabetes, he could have obesity. So still with all these very close to worldly affair with him, with the food, with the weather, the Raj Yoga means the art of living into the administrative setup where there is a possibility of vitiation of the thought. This is what I quote sometimes, like our Prime Minister, the Janak in the history, Lord Krishna, all these people, they had a transient phase of the Raj Yoga in their life before they went into the Vanaprastha Sanskar. So in Indian mythology, Raj Yoga is a yoga which is kept during your worldly life with your all possibilities of adversities, as well as the goodness, as well as the wealth, as well as the grandeur, and still you do not become sick. And even if you become sick, even your a limb is cut during the war period, you don't bleed that, you don't get shock syndrome, you don't get septicemia. So all adversities, all sickness, all such problems could be taken care of with the Raj Yoga. Thank you.
Thank you, Dr. Tripathi, sir, for making the points on Hatha Yoga and Raj Yoga so clear. So my next question is to Dr. Sandeep Rai again. Dr. Sandeep, how did Sahaj Yoga help the patients during COVID pandemics, especially the second wave?
Yeah, thank you, madam. Madam, COVID pandemic is unprecedented in modern history. I think we have never witnessed in recent times such a state. I'd just like to say that acute stress is survival. You are going in a jungle, you see a tiger, and immediately your stress system is activated. You are ready to fly or flight. Now that is giving a survival benefit. But when the stress becomes chronic, like in everyday life, then it starts releasing these bad molecules, which are called adrenaline, cortisol, and all these hormones, and starts the destruction of the body tissues and the organs. COVID was one such situation where we were under chronic stress. The humanity was under chronic stress. It was totally unknown what is going to happen. Life was at standstill. People lost jobs. And it was a stress of a kind which people had not experienced, for rich and poor both. Now, Sahaj Yoga did a lot of, help the people a lot, because there were two things. One, as I told you, that with this kind of meditation, which is a mental silence meditation, the stress factor, the chronic stress factor, it took care of in a big way. And so as we know, and all studies had shown that it was decreasing stress. People were calm in that turmoil. So the mental factor or the psychological factor, but more than that, it helped people physically also, because we know that meditation decreases your inflammatory markers. It decreases the oxidative stress. It decreased your IL-6. IL-6 was so much incriminated in COVID, and there are studies showing that meditation decreased IL-6. It increased the lymphocyte count, which was again a COVID. It has shown to decreasing the immunity. It is preventing you from infections, and it is also preventing from opportunistic infections by increasing your immunity, decreasing inflammatory markers, decreasing stress hormones and stress chemicals like adrenaline, cortisol. So in a way, it had a very calming effect. It made people fight with COVID in a better way. And as Sahaj Yoga is practiced in more than 130 countries, it's absolutely free, man. There is no charge everywhere. Anybody can practice at home and all. It's just activating your energies by meditating. And so what happened was that everything went online. And these programs were such a big success that they have got all records of Limca books and everything, because thousands of people joined in online meditations, Sahaj Yoga meditations all over the world. And it was such a relieving factor. It was such a calming factor. And we got reports from all over the world how it has helped people to tide away COVID. And the result is that still the online programs, people are not leaving, and still they are continuing even when COVID in a way has substantially abated. So it had a tremendous benefit in COVID.
Thank you, Dr. Sandeep. And I believe we do have neurophysiological proof that despite being in the stressful environment, body remains in the de-stressful state, right?
Yes.
And that is really improved the quality of life, and not only in patients, but also amongst the doctors during the COVID times. Thank you. So my next question is to Dr. Manchanda sir once again. So what asanas and pranayams are best for the cardiac patients? Are there any asanas or pranayams which are contraindicated in cardiac patients? Dr. Manchanda sir.
Well, you're quite right. There are several asanas and several pranayams which have been found to be useful. But if you see these studies, I'm talking of evidence-based studies in cardiology, they have been done with various types of parts of the yoga. For example, you just now heard from our speakers that there are three components of yoga. One is the asanas, the other is the pranayama, and third is the meditation. Now there are about 40% of the studies which are only with meditation, and they have found it's equally useful. There are studies meditation and pranayama, and there are studies which include all the three. The benefits of all the three are much better if you include, but the maximum benefit seems to be of meditation, because isolated studies of transcendental meditation and now mindfulness meditation have shown the same effect. So it seems that yoga mostly acts through the central nervous system, that it reduces the stress, as a result of which, as you just now heard, the catecholamine levels are reduced, the hypophysis pituitary axis is reduced, and the parasympathetic activity improves and the sympathetic decreases. So that improves the hormones, etc. But yes, even the stretching exercises or asanas do help also. Dr. Benson from Harvard Medical School had shown that even stretching exercises or asanas could be useful. But there are certain asanas which should not be done to certain patients. For example, if you are bending too much forward or you are raising the legs too much in patients like with heart failure, that can change your blood pressure markedly, and therefore such asanas like bending too much forwards or Surya Namaskar, etc., have to be avoided by certain patients of heart failure. Similarly, hypertensive patients have also to avoid certain asanas. For example, we don't advise Sheets asana or any asana in which the bending is too much and so forth. I think, as you just now heard, we need a good teacher for that. And what we had in all these studies, if you see, there were patients who were excluded, you see, who could not really be fitted into these studies and all those whose blood pressure was fluctuating, or those who were advanced stage of disease, etc. So what we try to do in yoga is that we try to stabilize the patient first, and then they can do everything. Like it is said, Kapalbhati should not be done to heart patients, but we had done in our thousands of patients as Kapalbhati. These were patients who were already controlled, and therefore slowly they could build it up and all that. But yes, certain asanas have to be avoided in which there's a definite change of blood volume, etc. And patients who cannot tolerate exercise, they have also to avoid certain asanas like Surya Namaskars repeatedly, etc., and all that thing. But the advantage of, I think, yoga is that it can be done when physical exercise is not possible. For example, I was giving you an example of heart failure. Heart failure, we were scared of doing exercise. Now, exercise has found to be extremely useful. But exercise is not possible in many patients to be done because they are bedridden, they have osteoarthritis, and their yoga can be done. And we devised a method so-called chair yoga about 30 years back, and we found the benefit is equally good. For example, patients who cannot sit on the floor because of osteoarthritis, they were sitting on the chair, they could do pranayama very well, they could do meditation very well. And then we studied them in the long run, the benefits were equally there. Only thing is, yes, if the joints also move, then you remain physically fit. But if you are physically even unfit, you can do these. So I think meditation has the maximum advantage, then has pranayama, and then there are certain benefits of asanas also. Ideally, all three should be combined. But in a patient with advanced heart disease or hypertension, which is fluctuating, one should avoid asanas in which there is a marked shift of the blood volumes, or there is increased physical activity, so that catecholamine levels are not increased. I must tell you here that yoga is not a few asanas. We have defined it as a complete way of life in which a person remains physically, mentally, and you heard now, emotionally and spiritually active. But I have called it a lifestyle polypill. This is the only method in which you can control your diet. Sattvic diet is a part of yoga. Then physical exercise is a part of yoga. Then stress control and tobacco cessation. So it is a lifestyle which can control all these factors. And I call it the best lifestyle. I call it a lifestyle polypill. We have published it many times that this is a lifestyle polypill, and it can be done by every patient. But patients with advanced disease, I think the physician or the doctor has to be involved in it. For example, if I send any cardiac patient to these yoga centers and all, I evaluate them and to see whether they'll be able to tolerate the various asanas especially. But pranayama and meditation is possible by every patient, and certain asanas have to be restricted in certain diseases.
Thank you very much, Dr. Machanda sir. You have made a very important point, and I think all of us should note it down that patients who have an advanced cardiac disease, they should do yoga under supervision of the doctor. I mean, it's not on, they should not just blindly follow, because it's become so rampant these days. You see a lot of gurus coming up and, you know, they say they can teach you yoga, but then yes, they have to be in touch with the doctor. And rightly said about chair yoga, because with age, we see a lot of people who are not able to sit on the floor and sit in Vajrasana, and so and they are equally benefited. So that's a very positive sign for such patients. And yes, yoga, of course, it's a lifestyle pill. Very rightly said. I really like the word lifestyle pill. Thank you, sir. Thank you so much. So before we finish a session, one last question to Dr. Amit Gupta, who's an ardent follower of Art of Living. Dr. Amit, are you there?
Yes, Dr. Padma, I'm there.
Yeah. So I just wanted to know from you, how does Sudarshan Kriya differ from the traditional way of practicing yoga? And does it have any added beneficial effects over Hatha Yoga or over the yoga that has been advocated by the old rishis?
Thank you, Dr. Padma, for asking this question. And not only myself, I know you yourself is also a very regular practitioner of Sudarshan Kriya Yoga and other practices. So I would just like to say that all the eminent speakers here have highlighted different aspects of yoga. So yoga is an umbrella term. And yoga is simply not yogasana. So two things should be clear, that it is not yogasana. And Dr. Vasant Kumar has already pointed out that it has to do with mind, body, and the other aspects. Spiritual, it has a spiritual connection also. So Sudarshan Kriya is more of a breathing technique, you can say, in terms of if you define it scientifically. And it incorporates other yogic practices also. And it helps you in connecting and attaining the level of, it helps you in attaining a higher level of connection with the consciousness. And it helps you in, it is also helpful in medical disorders and other clinical disorders also, because there are more than 200 research papers which has been published on Sudarshan Kriya Yoga alone. And they have been there for almost all the chronic diseases. And they have shown that these kind of practices can actually benefit. If you remember last year on this International Day of Yoga, we had the blessing of Gurudev Shri Shri Ravi Shankar, and Dr. Kamalakar Tripathi was also there. And along with Dr. Anuj Maheshwari, we carried out the conversation with him. And he was with the ACP India Chapter on this platform itself for half hour. And millions of people actually watched that episode. So I think it is of great value, and it is different from yoga asana, but it is something which gives you a holistic approach to yoga.
Thank you, Dr. Amit. I think everything is given in a capsule form, and it's very good for laymen who don't have much of a knowledge about insight into yoga and all. And it's more about when you do it, you see the difference yourself. And I believe they've done a lot of studies in AIMS, because when we had done the first course that my sister-in-law had started in Jhansi way back in 2000, and her aunt Tripta Dhawan, she was here with one doctor from AIMS, and we had done Sudarshan Kriya, the basic course here in Jhansi. Thank you very much. So now, before we finish with the panel discussion, and we are remaining with 3 minutes, I would like to thank all the panelists for very important insights into the topic. Dr. Kamalakar Tripathi sir, Dr. Manchanda sir, Dr. Sandeep Rai, and Dr. Vasant Kumar. Thank you so much. And now we begin with the second session on clinical evidences in favor of yoga, that is the science behind yoga. And I hand over the stage to Dr. Srinivas Murthy. So it's all yours, Dr. Srinivas Murthy. 3 minutes before.
We really appreciate, ma'am, and that's the part of our yoga. I think all of us are systematic, well-disciplined, that's what we say. And thanks to all the doyens in the field of medicine, Kamalakar Tripathi sir, Sandeep Rai sir, and Manchanda sir. And so far, we had the holistic approach, of course, philosophical also a little bit, but definitely today is an evidence-based era. I think in this evidence-based era, we want evidences, proof, RCTs, or real-world data to support our claims. Though it is age-old, it's a part of our tradition yoga, I would say, and including myself, we practice it very judiciously, religiously every day, and that is what keeps us, hale and healthy, both mentally and physically. I think now let's move on to a very interesting topic, a very innovative kind of a topic with by a self-starter, self-motivated youngster who was a first MBBS doctor to do a MD in yoga and rehabilitation in the world. And that's the specialty of Dr. Shashikant Kumbar. Very happy to be here that he's started an integrated holistic health center which integrated yoga in stress management and other diseases along with other systems of medicine. I think that is what is the specialty of Dr. Shashikant Kumbar, and he has also started epilepsy and yoga research in Spandana Holistic Health Center in collaboration with the Department of Neurosciences, Narayan Hrudayalaya in Bangalore. And he started a school-based yoga and health integrated services for various schools. And that is, I think, really appreciated point, because he wants youngsters to realize the importance of yoga in lifestyle modification and to go ahead to achieve their goals. I think without much delay, we want to eagerly hear Dr. Shashikant Kumbar regarding the science behind yoga. I'm sure all of us will be impressed. I've heard him before. I'm sure all of you will appreciate his approach to yoga and the reasoning behind the yoga. Over to you, Dr. Shashikant, and we sincerely thank on behalf of ACP India, myself and Dr. Anuba as part of Wellbeing Championship we are organizing for our physicians. This is just for your kind information. And this is the most important topic we would say, because all others are theory, and this is the only practical topic, I would say, which all of us can indulge every day in our daily routine. Over to you, sir.
Thank you very much, sir. First of all, I'm thankful for the opportunity to be here, because I'll share in the 30 minutes of glimpses, time is clicking, in the glimpses, my journey of 14 plus years, where I heard all the dignitaries with all the due love and respect. I have huge respect for all the doctors. I consider all the doctors are karma yogis which are not recognized. Throughout their life, they are not recognized. So each one of the doctor, whatever is field, whatever specialty, each one of them, I see them as a Sri Ravi Shankarji or any other senior dignitaries, because the entire life itself is a complete sacrifice. If you hear, so with a very kind, it is, for me, it is a fulfillment to be just here, not even talking. So in my MBBS time, I used to be a little follower of Swami Vivekananda, and I used to hear one of the word, my name, combine the best of the East, best of the West. That strikes me very hard, very badly. So I used to think that what is best in India right now is best of the West is modern medical science, and best of the East in India and Asia, specifically China and India. So if you say Chinese, you'll say Chinese Kung Fu, traditional Chinese medicine, acupuncture and all. For India, if you see, it's the Indian spirituality, yoga, Ayurveda, Indian, the cultural heritages, all the dance, Nritya, Bharatanatyam and all this. So that makes India a very unique country. And I was kind of in the quest of finding how to do this best of the West, best of the East. So then it struck me sometime like the family medicine, it was the upcoming medicine, integrative medicine and all those. So it struck my mind that integrative medicine, in one of the research study where I was reading about it, I found the two words, I am, integrative medicine, I am doctors. In UK and USA, they use this word, I am doctors. It struck me very badly, and I put my dream concept as I am well, integrative medicine and wellness. So that is the concept. So just to make all the different explanation of yoga, what is yoga, into condensed 1 minute form, is when I go to the West side, I usually express this, because non-religious format expressing this types of yoga is very difficult. So I divide the yoga into two categories. The purpose of yoga is to chitta vritti. It is easy to understand is the first time we received radio frequencies through the quartz crystals, because it has able to receive those radio waves. So when you study the crystals are made up of silica. Earth, more than 29+% of Earth contains pure silica, more than 60+% contains a silica in combination, all the Earth. So crystals have a uniform structure, like yantras, mantras, you see yantras, uniform structure. Crystals have that uniform structure. This could receive the frequencies of radio frequencies. You check the study of radio frequencies. Similarly, if me as a person, if I purify my mind, my body, and my being to the extent that chitta vritti, chitta nirodha, or chitta shuddhi, in easiest term, for me as a person, my body type, my genetic tendencies, to the best of the abilities of plus and minus, like oncogenes, all those other good and bad together is what it defines what will get disease, not get disease. If to the best of the abilities, if my genetic tendencies are expressed to best of the manner, that I call it as enlightenment for a person. No, so to connect individual consciousness with the cosmic consciousness, just like the radio frequency, it's easy to understand. We have to purify ourselves. For purification of the mind, purification of the body, purification of all these three aspects of the soul, so yoga is designed. So I divide it into two categories: path of yes, path of no. Easy to understand. Path of yes, path of no. In the path of yes, there is a system to follow. You follow this particular system, you'll achieve what you need to achieve to purify, so that you'll be able to connect yourself to a higher cosmic order, to receive that signal from the lower mind, mundane mind, to a human mind, from human mind to a divine mind. To receive those signals, you are upgrading yourself. So there is a system to follow. In that system to follow, path of yes, I'll categorize the Patanjali Yoga and Hatha Yoga, these two, and any other names you would like to include as a systems. That I'll give an example of. There is a religion, any religion, there is a set of practices to achieve what you need to achieve. Similarly, for yoga, this part of the yoga, path of yes, there is a path, Patanjali and Hatha Yoga. In other side, path of no, there is nothing. Non-believers of God, non-believers of existence of the godly element, just believer of nature. So there is also a path of no. We call it as a neti principle. In Indian, beauty is anything you do, there is a system to follow. You are allowed to do, believe God, not believe God, still we coexist. So path of yes, path of no, I add. And there are as many number of yoga schools as many number of individuals, you believe it or not. So what we discussed, Raj Yoga, Sri and few things, these are very few names. So basically it is an underground platform of Patanjali and Hatha Yoga. On this, everything is built, trademarked, and expressed, given to the world. So nothing bad about it. So this is in short is the path of yes, path of no. It's easy to understand. In this path of yes, path of no, I, as in my individual egoistic, ego-based mind, my individual mind has added a medical part of it. So basic foundation is Patanjali and Hatha Yoga. These two are little different based on our understanding. If somebody wants an occult power, I want to have a walk shuddhi, I want to have a knowledge or whatever occult powers you want to start, you will start with Hatha Yoga. You start with Asana. Asana, Pranayama, Bandha, Mudra, Kriya. So those are Hatha Yogas. It is for occult powers. If it is for the spiritual progress, for you to connect yourself with the higher orders, it's the Patanjali. It's the stepwise manner. Yama, Niyama, social do's and social don'ts. Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. So make your body strong, make your mind strong, and you will be able to connect to the higher order. That's in short about what we discussed so far. So my mind striked with the statistical information of the WHO long time before about this NCD statistics, non-communicable disease statistics. So every year 41 million people die. So this is what statistics about WHO. And in that statistics, the 70% of the deaths are only because of 4 categories of disease. It is very, very striking. Most of us, we as a doctors, we focus so much on the disease. Once the disease comes, we start working on it. But there is so much more to do. With that also, I'll give a bit of statistical information. These 4 categories of disease are considering more than 85% of death in middle-aged people. So those 4 categories are, first one is the cardiac, hypertension, myocardial infarction, all the cardiac related, congestive cardiac failure and all the related groups of diseases, cardiac first. Second one is cancer, all varieties of cancer. Third one is COPD, chronic obstructive pulmonary disease. Fourth one is diabetes. Just these 4 diseases institutes 41 million deaths per year. It's a huge staggering statistical data. And second data I should add is National Institute of Health USA have changed their idea towards integrative medicine. They used to, just conventional medicine used to go on, and they have seen a huge upsurge in the usage of alternative medical systems or complementary and alternative medical systems, CAM. They made it as CAM, complementary and alternative medicine. Amongst those CAM therapies, the top 10 were yoga and Ayurveda were top 10. Top 1 is, of course, is acupuncture and all those things, but they give a lot of statistical research with data. So that made me it is wow, yoga can be taken to such a great extent. But when we see around the world, lot of yoga teachers, yoga gurus just complete 1 month of yoga teachers training or 3 months of yoga teachers training without medical knowledge of anatomy, physiology, pathology, physiology. Absolutely, they start, okay, I'm the guru, and we'll start with that. Sorry for that side of explanation, but it is a reality. If intellectually you want to understand them, it will be, you find it very difficult. They talk about physical entities, mystical entities. They don't want to talk about the facts. This is where I find very difficult. I am losing hair because of so many people where absolutely, when we see about yoga, ultimately it is the foundation is, can I explain yoga in the form of isometric, isotonic exercises? Can I explain yoga in the form of gravitational, anti-gravitational exercises? There are less people who are into this stream, and it is absolutely good a stepping stone for the modern medical doctors to step in this particular field, because most of the so-called gurus, don't mind me saying this, it is a fact where most of the gurus or so-called babas, all the people, they start with anti-allopathy propaganda as a foundation for their, you see, hey, don't take English medicine, take this my medicine. Don't take this medicine, do the Adishadan Pranayama. So they start universally giving everything to everybody, same things. It is like giving paracetamol or Montelukast to everybody. Every sort of things you will get, all the disease you give Montelukast. It is not exactly so. There are hardly vertical height or a horizontal height. There are a lot of people with horizontal reach. Vertical height people are very less. So coming back to the point is, yoga has absolutely potential. When I see just the yama niyamas of Patanjali, if I add and work on it, I can prevent most of the sexually transmitted diseases of the world. When we're reading Park and Park, we never had this yama niyama included in this, where it should be included. Just by following moral, ethical values and social do's and don'ts, there are so many things which if we can prevent, well and good, So yoga is very interesting, where it works on all the muscles, cardiac, skeletal, smooth muscles. Most of the exercises are for the skeletal muscles. There are 84 lakhs of asanas. Believe it or not, 84 lakhs of asanas. Lord Shiva has condensed them and made them around 89 to 90 asanas. Most of the 90 asanas were practiced as a part of a standardized system, what we follow it as a protocol. These are all only less than 90 asanas. 84 lakhs of asanas plus how many number of skeletal muscles? It varies, 650 or 600 or whatever. So it varies. If you can work on skeletal muscles and asanas, there is some element. Only modern medical doctor can do it, because they spent their entire life, 14 years, 15 years. Just this is a sadhana. This is their tapas which nobody considers. Just because you are not wearing some turban and don't mind. So coming back to the point is, there is a huge potential to give yoga as an evidence-based modality as an add-on treatment. I'm very particularly into it as an add-on treatment. You are not replacing any conventional medicine, because conventional medicine is based on hardcore evidences, which is no secret keeping. So if we can use yoga as an add-on, there are so many much better avenues are available, but it is not standardized. And when we heard for hypertension, what are the asanas to be avoided? So it is a general vague. The asanas are very vague. There is not standardized protocol. For example, Kapalabhati, doing Kapalabhati, you avoid Kapalabhati and hypertension and epilepsy. Why? Epilepsy foci can be triggered by fast breathing. Hyperventilation like Bhastrika Pranayama, Kapalabhati. Hypoventilation like Nadi Shodhana Pranayama, left nostril breathing, Chandra Nulom Milom Pranayama. So yoga, there are few research I would like to quote. Yoga, long-term yoga practitioners, their GABA levels are higher. This one research, gamma aminobenzoic acid GABA levels are higher. Long-term yoga practitioners, their amygdala and hippocampal area are bigger, larger. Emotional control will be much better. There's one discussion where we're saying pain management. The way you train the reticular pathway of your brain, pain pathway. If my training is better, morphine I can use for palliative care plus psychotherapy technique where I can use sankalpa, an auto suggestion to put it in the subconscious mind. That can work like a morphine. Is good. It is doable because there is a transition. There is a hypnagogic state from the conscious mind dimension. When you go a little deeper, just before sleep, there is a phase of a semi-conscious, semi-unconscious sleep-like state. We call it as a hypnagogic state medically. And this yogis will call it as yoga nidra, they'll call psychic sleep. Psychic sleep means consciously you are bringing the number of thoughts, number of, there is one research which quote there are 50 to 60,000 random thoughts per day, conscious, subconscious, sleeping, dreaming, all inclusive. Number of thoughts reduces, sympathetic overactivity reduces. One of the senior said, yoga in medical field is a transition from overactivity of the sympathetic nervous system towards the activities of a parasympathetic nervous system. There is a disparity, as the MCD statistics says, there is a disparity of sympathetic, parasympathetic. Sympathetic overtone, increase in the peripheral resistance, the blood pressure, increase in the peripheral resistance. There are 2-3 research articles which shows simply working on the mind, the peripheral resistance in the diabetic patients have reduced. This is there. Diabetic neuropathy was much better by addition of simple hypnotherapy techniques. Hypnotherapy, I say, hypnotherapy for a modern medicine, yoga nidra for your Indian context. If that can be used together as a module, standardized modules like senior dignitaries like you, if people can approve, you can definitely do. I'll correlate allergic rhinitis for an ENT doctor. At last treatment for allergic rhinitis will say systematic desensitization. Correlating with yogic module is Jalaneti. You put water, lukewarm water, saline water into the one side of the nostril, you take out from the other side of the nostril, you are irritating the nasal mucosa. So keep on irritating once in a given stipulated module. After that, you add Jalaneti. Next you will add is Dugdhaneti. You add milk, lukewarm milk, then do the same irritation. Then next one level is Ghruthaneti. They'll add a purified hot ghee to the nostril, take out from other side. The nasal mucosa relearns the hypersensitivity of the nasal mucosa reduces. There's already their treatment. Systematic desensitization is there last module, but we have not put enough module into practice to do this. Can be done. So yoga people use this lukewarm water. So when enough water is put it in the stomach for vomiting. So when you're doing Vamanadoti and other kriyas, you're actually working on the smooth muscles. Very fascinating. No other exercise in the world have activity to work on the smooth muscles. Ultimately, to achieve voluntary control over the involuntary nervous system is an idea where you consciously go into the subconscious mind. From the subconscious, you connect it to the intelligence which is working, governing the body. If you're able to grab that knowledge, you will be able to connect with the higher orders easily. If you can tap that, then if that higher order comes in, the complete activation of your genetic code will be the enlightenment. So thalamic relay station were bigger in the people who are meditating. I quote 3 doctors which were very greatly influenced my mind is Dr. Tony Nadir, who was a successor of transcendental meditation, first ever yoga and Ayurveda research activities. Maharshi Mahesh Yogi has been awarded 90 kg gold of his body weight. A physician getting a 90 kg gold for his work on Patanjali Yoga Sutra, where he beautifully correlated. I see, wow, what is this kind of? He beautifully correlated 4 padas of Patanjali to the lobes. Each Salkai and Gaire, they'll say, he'll correlate with one sutra. So this is most fascinating integrating point between the mystical aspect of the yoga, which we think, oh, what is this? To a logically concluding ability to influence to left side, worldly people, scientists and thinkers, to make it, wow, okay, what is this kind of? Dr. Tony Nadir. Second is Dr. Mehmet Oz, who is a cardiothoracic surgeon who teaches yoga, and he uses pomegranate juice for his patients, cardiothoracic patients. He's still alive. As Sir was also mentioning, Dr. Herbert Benson, one of the greatest work done by Harvard medical doctor towards yoga. Greatest contribution is Harvard medical scientist Dr. Herbert Benson. Release of nitric oxide in the endothelium will induce a system called as the relaxation response. I recommend his book, The Relaxation Response. He first worked on Tibetan monks. So those Tibetan monks were doing Hatha Yoga, which was derived from the Indian tradition, which has drifted away and taken it out and given back to us as mindfulness breathing, mindfulness meditation, mindfulness stress breathing technique from the Western side. But it is already, if I give you a correlation, scriptural correlation, first sutra of Vijnana Bhairava Tantra tells about breath awareness. The breath awareness was practiced by Buddha, who was a non-believer of the God. I love him because he was a scientist, like us, all of us, non-believer of God. Then he was enlightened. This is most acceptable part to the outside world, because without any medium or a symbol or religious identity, he could explain to the world how best the path can be achieved, those 8 teaching methods and noble paths. So my correlation is the mindfulness breathing technique is there in the Vijnana Bhairava Tantra first sutra. All the gurus, bigger gurus, will never tell us is hyperventilation techniques derived from Vijnana Bhairava Tantra, where the Lord Shiva, ancient Adi Yogi, as we were mentioning, teaches 112 meditation techniques to his wife Parvati. So Shiva is a universal consciousness, pure consciousness. Parvati is the nature, Prakriti and Purusha. So it's an debatable context where, so this is already there existing. 112 meditation technique, add-on breathing technique. Make a permutation combination, 500 plus meditation technique you can make. Choose one of them, name some particular name, trademark this, you will become guru fast. After another 10-20 years, you'll see me growing all the beard and all. Sorry for that. Yeah. So coming back is, yoga is beautifully used if it is in the right hand. So this is my appeal to a medical field, where simple practices. Why can't see, in our case, after the complete medical history, I'll give each patient, I'll give hospital anxiety depression scale, HAD score, validated score system, GHQ, General Health Questionnaire, and all the questionnaires which are there used in psychotherapy, psychology. Why can't we use for back pain? Epworth sleep scale, Beck's inventory, anxiety inventory, Beck's depression inventory. Why can't you use as an add-on medical history plus addition of the questionnaire, which tells about the quality of life, QOL, epilepsy, quality of life in epilepsy, example. So ultimately, if we are in sync with the Yama Niyamas, or if we are in sync with the Brahmi Muhurta, if we say wake up in the Brahmi Muhurta, it might be what they are saying is, you get up little early, where the hypothalamo-pituitary adrenal axis is working better. Hypothalamo-pituitary thyroid axis is working better. Hypothalamo-pituitary other axes are working better. So that is the time where the hormone secretion is much better. If I correlate Western psychology and Indian psychology is nothing but Patanjali Yoga Sutra. Nowhere in the entire world, there is a description about how the mind works, how the modification of the mind, how the mind can be increased to a supranormal mind, higher mind. So there is nowhere else, no other scripture except for Patanjali Yoga Sutra. We never know it. We being modern medical doctors, we rely on the psychotherapy. Yes, it is good only, nothing bad. But psychotherapy understands pathological mind first, without understanding the normal mind. If I say cognitive behavioral therapy modules 1, 2, 3, 4, 5, if I can incorporate the Indian systems, which is a little bit correlation, if I can do that correlation, it's absolutely, we can derive a lot of scientific evidences that are already there. We can still derive much more. I'll just give a pause. Where speaking in front of such a big dignitaries, for me, I feel, like Arjuna, Arjuna, dry mouth and all those. There is absolute sympathetic overactivity. It is, fine. So there are so many somatic symptoms. You believe stress is more. There is increase in the gastrin secretion. Gastrin increases the hydrochloric acid. Hydrochloric acid causes gastritis or esophagitis. We as a doctors, we give antacid. Yes, of course, fine. That's one module. It's evidence-based module. But are we working on the stressor? Then the treatment aspect is complete. If I am working on the stressor, understanding the stress levels of a person, source of stress, and then add we as a doctors, we focus exclusively on the body. If we can make it little bit comprehensive, little more time, if we can add, may not be you, but somebody like us who are. So for me, it's like I'm retired past 10 years. After 2010, I decided not to work. I was working in a Vikram Hospital and other hospitals as an adjunct therapy for a neuro rehabilitation unit. It's very interesting. Like first 6 months of stroke rehabilitation. The neuroplasticity is relearning your brain like a child again. How much time we need to dedicate and give. Neuroplasticity is a great sense. Yoga can be used as a module for a neuroplasticity. It's the greatest module for neuroplasticity. So all this relaxation technique, instant relaxation technique, deep relaxation technique, I teach more of a Jacobson's progressive muscular relaxation technique. Because when I teach Western things to India, Indians usually will accept easily. So Jacobson was a Canadian physician very much interested in yoga. And he designed the module which he uses 5 seconds of contraction of muscles and 5 seconds of relaxation. It is a biorhythm change. You're slowly changing the biorhythm of the body. So body is relearning. If I use for all the hypertension, I use the JPMR technique 40 days continuously, 19 minutes of practice. So JPMR for the people who want the scientific one. So Yoga Nidra exclusively focusing on the hypertension. We'll design and give it to a patient based on their style. What is their body style? What is are they endomorph, ectomorph, mesomorph? What is their mind state? Are they fast thinking? Those are additional things. In little correlation with Ayurveda, Ayurveda says Vata, Pitta, Kapha for the people. Modern medical doctors will say, Vata, what is this Vata, Pitta, Kapha? So I correlated with, when I go out, Vata is a kinetic energy, Pitta is a thermodynamic energy, Kapha is a potential energy. Vata is similar to the ectomorph, Pitta is similar to the mesomorph, Kapha is similar to the endomorph. So there is gross correlation you can do, correlation. The thin-built person, mind will be very fast, number of thoughts are fast, somatic symptoms will be more. The psychosomatic symptoms are common in the person who is thin-built. Hair loss will be little common in the person who is thin-built. So it depends. So you can, if this kind of correlation exists, it is hypothetically we are talking, but there is a certain amount of evidence at the background. It makes a wonderful contribution. One doctor doing one research in their lifetime. So senior dignitaries like you, just small fellows like me, who you should consider me as only MBBS doctor. Where I love to work with. So there is one. I want to quote one research article by Dr. John Ebenezer, who is my best friend. PhD doctor, who is a Guinness Book of World Record holder for orthopedic. You find out he quoted fracture healing with pranic energization technique, PET, pranic energization technique. Fracture healing duration was reduced from 6 weeks to 4 weeks. Research is there. Find out. It's a beautiful, absolutely how if yoga is stuck with the medical mind, you can do wonders. Simple. Your patients are waiting, 30, 40 patients are waiting. We'll give you questionnaire, ADS questionnaire, whatever, back pain questionnaire, diabetic questionnaire. somatic symptom scale. 90 questionnaires is there, 14 is also there. We have so many questionnaires. Just give them questionnaires, take the information. If somatic symptoms are higher, they need more of the mind workup. The insulin patch will not work for them. If the relaxation plus insulin patch, the disease recovery will be much better. Another doctor, Dr. Paramesh, who is the director of Twin Heart, published a research article on diabetes reversal. It's where they focus on the diet, mind, and all the yoga aspects. So, other particular doctor who is like a father of modern stress is Dr. Robert Sapolsky, the greatest motivator, where he 30 years of his entire life went to collect baboon monkey's blood to check what is adrenaline level, noradrenaline level. So just check this. He has written a complete detailed work of how stress works on the immunity, how stress works on, there is interleukins, how stress works on other hormonal status. The to end is yoga can be used as a module to reduce the chronic inflammation, elastic recoil capacity of the muscle fiber. If we can work on the collagen content changes, elastic recoil changes, the module changes. If I use yoga as a tool to telomerase, is there anything by doing particular style of yoga, XYZ medical yoga, if I say medical yoga, XYZ yoga, by doing that, if the telomerase is better, if the telomere the length is it is increased, is reduced, the reduction of telomere length by the addition of yoga, if you can prevent or delay the shortening, so that is a tool for longevity. So there are so many thousands of simple tests like galvanic skin resistance meter, and do the simple Nadi Shodhana Pranayam. If I am adopting Namaskar Mudra, I put lot of efforts on this. Simply joining hands together, both hands together, I say there is a hemispherical synchronization. Why? The number of receptors are maximum in your hand. Motor homunculus, sensory homunculus. Number of receptors are maximum. Hand is the second organ after the face for the communication. Most of the Hindu or Buddhist philosophers uses mudras. Mudras, by adopting certain postures or Jnana Mudra, all the mudras, there are 729 mudras. All those were lost. Most of the books were lost. So, number of receptors are higher. Are you connecting, channelizing any psycho-neural channels by adopting something? Maybe, we do not know. If I do some certain mudras and check what is the functional brain MRI, is there any dopamine, lightening of the dopamine different in certain mudras? We need to do. If there is a facilities available, I'm willing to run around each doctors and meet. So, this is just a love of yoga and a concept of integrative medicine, where a doctor teaching yoga makes a huge difference. 20 to 30, 50,000 of yoga teachers and one doctor make a huge difference in effectively implementing the strategies needed for us to add yoga as an add-on therapy properly. Where
Very
now
well
we're
said,
adding
Definitely.
yoga as a vague entity. If I add properly, there should be protocol. So protocol for stroke, what we do. So we'll check the signs and symptoms. How similarly we should have a protocol for yoga. Then it should be validated by dignitaries like you, and then it should be accepted, acknowledged. That should be promoted. That should be accepted.
Very
With
well
this,
said, sir.
short-
It is the need of the hour. What you actually gave us such a lot of insight into the scientific aspect of the yoga. Yoga is a way of life. It's like an ancient practice which we do correlate as a spiritual well-being, if we say. But during the last 1.5 hours, we have actually viewed the philosophy, the science, and definitely the evidence-based. You very well explained and showed the new insight, the scientific insights in the yoga, and we can just assure you that it can definitely be used as a tool, as an adjuvant tool for the treatment of many chronic illnesses. Actually, we are running short of time. We'll again.
I'd like to take just one example,
okay,
and end the one example and end.
Please.
For example, I use the Merudanda Mudra. For example, Merudanda Mudra, it's a in a scriptural sense, it is just mudra for back pain. So when I went and learned acupuncture for about 9 to 10 months in China, I correlate that they believe that this is a holographic image of each cell has a holographic image of the entire body. When I do a hyperextension of a thumb, I am sending the stretch reflex. My left brain is understanding the stretch. There is an overstretch happening, and because of this overstretch, the pain receptor reticular system is working in a certain way. It is forgetting the back muscle spasm. It is forgetting the trapezius muscle spasm. It is forgetting rotator cuff issues spasm, and it is focusing on this. So certainly for some time, endorphins and enkephalins are released to a level where you feel the pain is relieved for a short while because brain is focusing on this. Because again, coming back, stretch is there, number of receptors are more here. There's something brain is overthinking. Thumb has the biggest area in the motor cortex, you know. So this is how I use certain aspects. When you use anything, thumb is majority used in most of the mudras. Maybe scientifically, the thumb has the biggest area in the brain. So that there should be some correlation. This is, I think this is not adopted from any books or things. It is like a quest to do it, trying to convince medical doctors. I went around to 40 to 50 hospitals. One of the hospital management said very clearly that you want to prevent disease. You want patients not to come to the hospital. Our strategy is different. We want patients to come to the hospital. So this strategy will not work. No. Thank you. With this small platform to share my small views in front of the august audience, I'm extremely thankful for just this simple opportunity.
Thank you, sir. You have been able to enlighten so many minds, so many legendary people here. And definitely, this should be the focus today. We actually should follow the path where we can use it in the modern medicine. It should not be talked about only as our ancient or a spiritual medicine, but definitely in the scientific medicine itself.
Shashikant, you have impressed many minds, and I'm sure I'll be getting more calls to engage you for more of our programs. We'll disturb you very often in future also.
It's a great honor, sir.
We invite you. And
it's the greatest honor the past 10 years. It's the greatest honor for me to just to sit in front of you itself. It's the greatest honor.
It's our pleasure and honor, sir. Thank you. And only thing I didn't like, you're talking about a tall, thin person with less hair. So that's the only point I didn't like about.
No, that is the example.
You're describing about me.
No, that's about me also. That is an example.
And Verma sir is another person who works in chronomedicine, who is our secretary of ACP, and he will be very impressed. I'm sure he will call me after the program is done, and he will inquire about you, because he's literally a father of chronomedicine in our country, and he's waiting to give a vote of thanks. Verma sir,
we'll invite sir.
Yeah. Over to you, sir. I'm sure you'll have some pearls of wisdom for us after Dr. Shashikant Kumbar's lecture, and of course, all the panel discussion we had earlier also about yoga. Over to you, sir.
Thank you. Thank you for giving me this opportunity on this very auspicious day. After all, everybody will agree that yoga has a substance. That is why 172 countries have agreed to this ancient Indian, I will say, method, and they agreed for International Yoga Day. 172 countries. Without any evidence, it's not possible. I would like to say, just after listening so many persons and a lot of wisdom from the orators, I can only say it is a complete science. Complete science. Nothing not scientific. Everything is 100% scientific. Here I will like to say what we are practicing in our day-to-day life. That may not be science, but this is 100% science. We are just repeating things. We are just giving medicines after listening symptoms. That may not be a science, but yoga is a complete science. And I'm a professor of physiology. So what if you asked me to say yoga in one word, I will say one line. I will say that yoga is just, you all know that autonomic nervous system is the most important system to regulate our cardiovascular system and respiratory system and other systems as well. So by yoga, we can regulate autonomic nervous system. So the higher system of the brain can override auto-regulatory system. our autonomic nervous system. Because if you take the example of breath holding, what is this? If the our respiratory rate is autonomic, then how we can hold breath? So if the breath holding can be increased, it is because of the over parasympathetic drive. So if we can regulate our own autonomic system, that is done only by yoga. And whatever talked about the Patanjali in Hatha Yoga is the last thing 5,000 years ago, when Patanjali, usually it is said 400 to 500 BC. 400 to 500 BC, Patanjali was the first person who wrote something about yoga. Before that, in our Indian system, there was nothing in written. Every science was oral. Guru Shishya Parampara, and Guru used to tell everything to Shishya, and Shishya again followed it to their Shishya. And that was the routine in our Indian setup. That is why we do not have any written evidences. That is why nowadays everything is evidence-based, and we are lacking in that because we do not have anything written. Patanjali was the first person who wrote about all this Ashtanga Yoga, and that Ashtanga Yoga is also called Hatha Yoga because here everybody tries to do that by Hatha. That is why it is called Hatha. So yoga is a complete science, and moreover, it is for one person only. That is, those who are doing yoga practices, they will be benefited. This is not for demonstration. So if anybody tries to demonstrate yoga postures on television or in any program, he's just befooling themselves and others as well. It is not possible. So it is only for one person who can understand this and following all the Ashtanga methods of yoga, then only, not only asanas, not only pranayams, not only chanting something, it is not yoga. So like other methodologies, here again, lot of things have come after the use of the yoga, but the real essence of yoga is it is for humanity. That is the this year's you can say slogan for the yoga for humanity. And whatever I can understand in the last 35 to 40 years of my medical life, I found it a complete science. And if you just study the physiology and the autonomic nervous system, you will have a glimpse of this particular science. But this cannot be a method for treatment. No, it is just a way of living, healthy living, I would say. So it can help, like other methods can help us to become healthy, but it cannot replace any medicine. So very beautifully explained by our speaker that it is in the CAM. It is part of that, not the just because it is a method of treatment. No, it cannot treat diabetes, it cannot treat hypertension, it cannot treat coronary artery disease. No, that is cheating. It is just helping us to have good health and remain healthy without getting the illness. So I will like to say this, that is a complete science, and one had to understand this and believe it. Then only one can get the help from it and can be benefited from out of it. Not selling the yoga. Most of the harm to yoga has been done by the sellers of yoga, those who are very, very commonly seen on the television, on the various fronts, on the social media, any media, giving some videos, YouTube videos. The yoga cannot be taught by YouTube videos. No, by just seeing a video, one cannot become a surgeon. Just by seeing the video, you cannot be expert. So this is not possible. And yoga can only be learned under a yoga expert. And that person who should know the modern medicine, the modern normal physiology, anatomy, as well the Ashtanga Yoga principles. Thank you. Thank you very much for giving this opportunity to talk something in front of you all.
Thank you, sir. Dr. Padma, ma'am. Any closing remarks?
Yeah, thank you. I would like to thank all the panelists and speakers and chairpersons. And I would also like to thank Dr. Verma. You missed the initial session, panel discussion and yoga. We had very interesting points. And we really missed you during the initial session. And I'm really grateful to Dr. Anuj, Governor of ACP India Chapter, for trusting in me and in my capabilities to carry on this program. Thank you very much. Thank you. And
Thank you.
I
Thank
would,
you,
at the
everyone.
last, I would like to thank RX Events team to conduct it so well. Thank you. Thank you. Pranam.
Good day. Good day.
Thank you.